Hi, this is Junaid, AINeuroCare stroke and epilepsy specialist. In this particular lecture, we're going to discuss future of hospitals. Now, why is it important? We're going to see a shift in the market, and that market shift is basically due to virtual care, due to remote patient monitoring, and how the whole overall industry is moving towards providing care at home. As a matter of fact, there's a whole industry, and rightly so, to age gracefully at home, because we really want our patients to be able to have a home environment in which they can get care for. And that is definitely one of the top things wish list for adult patients, because they want to really age gracefully in their own homes. And actually, that's one of the wishes, that they want to really die also in their own homes as well. So we're seeing a shift as far as that is concerned. And given that, the virtual care, remote patient monitoring, what is really the future of hospitals here? So we're going to see that there needs to be a new use case scenario for the hospitals. If you look at this chart, it is literally seen right now that the current care environment, 15% of acute care, which is the hospital, emergency room, etc., is going to go down to 5%. And then we are also seeing ambulatory care, which is about 80%. You have to go into the office and get care, etc. That is going down significantly. It's only going to be 30% representative. And if you're going to see home and digital care, that is significantly going to rise, about 40% and 25%. When you're choosing your specialty, that is extremely important. Is there an avenue in your subspecialty that you can provide care virtually? Is there an avenue in your subspecialty that you're going to be able to provide care at home? So those are the kind of things you need to ask when you are choosing your medical specialty, because that is the thing that is a momentous shift as far as care setting is concerned. Because initially we were providing care mainly in hospital or in offices, and now all these offices and buildings and billions of dollars of infrastructure is going to need a new use case scenario. Everyone's preparing for it, by the way. I'm preparing for it, right? I mean, that's my primary job as far as clinical strategist, is to make healthcare systems aware of this change as well, and how to plan for it in terms of continuity of care, and especially in neurocritical care and neurology. So that's what we are building up, the whole process, the pathways and everything. And as remote patient monitoring reimbursement is coming through, we're going to see more and more of these devices and everything, including event management, etc. Believe it or not, can be done at home, especially when there's a tele-ICU physician that could come. So these are the things that we are looking at as far as industry is concerned. And the advances in technology is really pushing these changes forward. The other thing is value-based care, right? The other big issue is that we really need to decrease the cost, the national expenditure, and we're going to come in the next few lectures. And as I discussed before, that the national healthcare expenditure is blown out of proportion, and we really need to find some way to bring value. And one of the ways to bring value is to bring care to the patient in their care setting, and that would actually decrease one of the major overheads within the whole industry. So there's the other big push, especially from policymakers and governments and everything, is that, hey, look, enough is enough. I'm going to pay X either way, if you want to take care of it in the hospital, if you want to take care of it at home. And then you're going to realize that at some point, that the CEOs of the hospital, that, man, I need a pipeline where I can decrease the overhead costs. So either way, what we are doing is that there's a significant shift, and that shift is accelerated, massively accelerated, due to COVID and the policies that went behind COVID, expansion of virtual care, etc. And dearly, these things are going to affect your choice of specialty. So make sure you take that into account. Now, this is a CEO of a healthcare system, and I'm going to read it verbatim. So all of my investment now is in outpatient. That is, towards ambulatory care, that it can be provided at home. Anything that is not beds, anything like this is not in the hospital, anything that is non-beds. Our ability to create that network outside of hospital is huge. So everyone is concentrating on that portion of things, because that's where the money is going to be in the future. So if there is a healthcare system CEO listening to this, and not planning for it, it's unfortunate, because we're going to see a significant shift moving forward, and this is going to come sooner than later, because as I said, it's the contactless care initiated the whole movement of virtual care is not going to go away, because patients have also understood the convenience of it. The focus of past 10 years has been preventing readmissions, and now in the next year, the focus will be preventing admissions. Boom. That is the best way that I can describe. That's another president of a healthcare system that said it. Use remote patient monitoring. Use any in-time telehealth provisions so that you can actually prevent that actual patient to get into the hospital. Just to give you one example, right? You can have a butterfly ultrasound machine that the patient can use with artificial intelligence, look at the congestive heart failure, is it worsening or not, and that patient can send images to the cardiologist. By doing that, they have saved costly $3,000 per night hospital admission, and the cost of the butterfly ultrasound is $5,000. So send it to as many patients, because if you prevent literally 2 days in admission, one extra Lasix dose can do that. Boom, you have created such a huge value. And that's where the whole thing is, from preventing readmissions to preventing admissions. Our mission is to provide healthcare to the community. If we deliver care at the community in a better quality manner that is less capital intensive, that's the word. Everyone's after the money. We have to save the money. Then is better for our fiduciary commitment to the community as well. And that makes sense, right? I mean, what I'm saying is that that value just talked about within the cardiology example is extremely important, because at the end of the day, community investments also matters, because buildings can be repurposed for acute rehabs, etc., which is more important, or anything else. And more importantly, less money is going into treating the problem that we can treat more faster, simpler, preventing admissions at the same time. Again, all these resources are on the Academy website. Grateful for your time. If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.